Shall I do one live?
No, let her come, no?
Any posting करना हो उसमें?
Yes, ma'am, I'm here.
थोड़ा सा अपना बॉडी दिखना चाहिए तुम्हारा.
Okay, okay.
हाँ. नहीं, अभी ओनली सिर दिख रहा है.
नहीं, I'm adjusting 1 minute.
बेटर. हाँ निकेत. So we'll have to do some chit chat a bit.
It's being live streamed.
Hello, Dr. Mansi. How are you?
Hello, ma'am. How are you? And wish you a very happy new year. Shubha Navabarish.
Thank you,
And also
Mansi.
to
Thank
all
you.
our Bengali viewers, especially Paula Vaishak and Shubha Navabarish. With
Thank you.
exam periods going on and competitive exams on the head, there is a lot of stress around. So today we are here to discuss how parents can help for the academic success of their children. I am Dr. Mansi Dugar and I'm in conversation with Dr. Paula Goel, founder of Faith Clinic. She is a pediatrician and adolescent specialist trained in lifestyle medicine. So with this, ma'am, I would like to ask you, actually, what do you mean by academic success? Is it just about getting marks?
Thank you, Dr. Mansi, and a warm welcome to all our viewers for taking out the time to attend this session. And happy Navabarsha and Paila Boishak to all our Bengali viewers. When we talk about academic success, it's not just about getting marks. This is what I want to stress on, Mansi. It's getting into the career and the subjects of your choice, of doing what you like, what you enjoy studying. You know, constantly being motivated by the course that you have joined. So if you like your subject and your course, you are going to be motivated, you will enjoy studying, and it will interest you. And obviously, you're going to do more research in it. And as a result, your marks, your scores are also going to go up, you know, but that's not the primary thing. So it is going to give you so much of happiness and joy, and you actually start shining. And that's when you achieve your academic success. So the joys which you get by getting into a career which you actually love, like doing it every day on a everyday basis leads to academic success.
So basically, it's the child's interest which is more helpful for academic success. Okay,
yes,
now
of course.
What should parents do before and during the exams? Like anything, you know, parents should do for it.
Precisely. So what happens basically when we are talking of academic success, most of the time you will realize that the child is in a situation where there is no interest and there is a lot of pressure which comes from the parents. So it's the parents and the situation, the environment, the school, college, whatever. There's a lot of jisko hum bolte pinching. The child keeps on getting constantly pinched in order to perform. And this is where parents play a very important role. Now, if you realize now with your mother, Mansi.
Yes, yes.
So let me ask you a very simple question. Do you get stressed when your kids are appearing for exam?
Oh yes, at times I feel it's my exam.
Yes, so that is precisely what happens to most of the parents, mothers specifically. They all get stressed.
I agree.
What happens when parents get stressed? They transmit their stress and anxiety to their children. So what can parents do? First foremost, they need to decrease their own stress, provide unconditional love, provide physical, mental, as well as emotional support. Now, what is meant by physical support? So the room in which your child is studying, that has to be properly ventilated, aerated. The windows should be kept open. The sheets should be changed. It should be clean. There should be fresh water in the room. What is the reason? Because if you keep a room which is completely closed with only the AC going on, there is sometimes an increased level of carbon dioxide which occurs without the fresh air coming in. And this actually clogs the brain. The person loses focus and there is loss of attention. Then the parents also need to understand that they have to be a buffer or a cushion for their child, because children at this time tend to become very irritable, because they're under so much of stress. So parents have to lend them a ear, be absorbing, understand what your child is going through. So you should have good open communication channels with your children. Be there for them. And last but two more important points is food and sleep. They have to ensure that the right type of food goes in, and sleep. Sleep is very essential. So in a nutshell, at least if the parents do this much, I think it's more than sufficient.
So it's the parents are not supposed to go behind the child, nagging them. They have to give a listening ear and less of talk.
Yes, yes.
So must give
and
support to the child.
And not take up studies. There's also a point where it causes a lot of stress.
Right. Ma'am, you have mentioned about food. So what type of food should be given? Because children are very fussy during, anyways they are, but what during exams especially?
Food is very important at all points of time. And in exam times, it becomes more important for two reasons. Because when the child, whatever may be the age of the child, they're studying, the brain requires maximum amount of glucose, so which comes from your food. But there would be fussy eaters who don't eat, and there would be children who consume a lot of food, and they're always hungry. So food have to be nutritious, they have to be healthy, but nutritious and healthy food, nobody wants to eat. So food needs to be interesting. It has to smell good. It has to taste good. It has to look good. And this is when most of the mothers think, and even the children think, that outside food is very good because it's tasty, it smells good, it looks good. But let me tell you one thing. Outside food, whatever you order from outside, you don't know the way it is prepared, and they have a lot of spices, it's oily, and it causes a lot of gasidity, reflux, bloating. And this type of food, a large amount of carbohydrate food. So you order naan and you order, let's say, pulao or something like that, that causes, or even sandwiches, they cause a lot of lethargy and drowsiness because of the high oil content, or also because of the high caloric or the carbohydrate content. So avoid oily, spicy, and too much of carbohydrate, okay? Because the alertness is lost. Maintain hydration. So you have to be drinking a lot of water, nimbu pani, chas, coconut water. Avoid caffeinated drinks. So do not give tea, coffee, do not give energy drinks like Red Bull. A large number of teenagers, they actually resort to drinking energy drinks and caffeine. Many parents think that fruit juices are good. But let me tell you one thing. Your Tetra Pak fruit juices also contain a large amount of sugar. So giving the fruit juices as well as the carbonated drinks, again, would cause lethargy and drowsiness because of the high sugar content. So food should be basically high protein. So you can give your sprouts, dal, fish, eggs, chicken, and also high fiber food. So a lot of salads, fruits, jowar ki bhakri, ragi, jowar, bajra, brown rice, red rice. So this is something which you can give. So hydration, high fiber food, and increased protein in the food. So this is what is important for any mother to just remember this much.
So it's like more of liquids should be provided to the children.
Not just liquids. We are talking more in terms of fluids, as in which will hydrate. What hydrate?
Specifically the ones which you mentioned, coconut water, nimbu pani, like that.
Right. Yes.
Ma'am, you also mentioned about Sleep.
Sleep.
So why is sleep important?
So exam times, as you know, are very stressful period, not only for the child, but the entire family as a whole. So it's not just the parents. If there are grandparents, they are also stressed out. And sleep is a very essential factor. Why? Because a good restful sleep will help to process your memory, and it also helps the body to feel rested and rejuvenated. Lack of sleep will lead to poor performance. So with good sleep, your focus, your concentration improves, your memory fog decreases, and it improves performance. We have to tell our children that the last moment cramming or the last moment learning by rote, it never works. So what is the point of trying to study so much on the last day? Last day, you must actually rest and eat well. The stress of studying on the last day, it leads to a lot of anxiety. And this anxiety also leads to memory lapses and affects performance. Hence, it is very important that parents as well as children understand that a good sleep, restful sleep is very necessary, not only during the exams, but just before the exams as well.
So Ratta Maro does not work.
Absolutely not. Absolutely not.
Ma'am, yes, please.
And of course, there are some students who also do late night studies.
Yes, I was coming to that. Like for
Okay.
younger children, it is okay. But what about the elder ones, like the older ones who study on their own? There are students who wake up till late and study.
Yeah. So the students who are the older students, maybe they are in their teenagers, about 14, 15, 17, they are studying late. Sometimes they're studying so late as they go to sleep by 4 a.m. or 3:30 a.m. So this becomes again very dangerous, because if you are awake for such long periods of time, you are going to become hungry. And when you are hungry, you're going to attack the kitchen and eat all the wrong foods, like cakes, biscuits, or maybe just make some of them even make noodles in the night when parents are asleep.
Yes, whatever they grab, they can.
So they start eating that sort of food which is unhealthy food. Now this type of food and eating at such terrible hours, it again causes acidity and reflux and abdominal bloating, and hence it affects the sleep, restful sleep. Also, we must understand that the older children are studying from their gadgets, and most of them are onto their laptops or desktops. Now, the blue light from the gadget, it suppresses melatonin, which is a sleep hormone. Now, if the sleep hormone is suppressed, so obviously sleep is affected, and this leads to very bad sleeping patterns, and as a result of which there's a lot of metabolic disturbances, which means the sugar levels go up, the cholesterol level goes up, the insulin resistance starts occurring, weight gain occurs. So you will see that during exam time, a lot of children keep on gaining weight, and there is a lot of anxiety. So this whole thing becomes a very vicious cycle, and this will again affect sleep. So these two things will have to be kept in mind.
So what can parents do for this?
So the first thing that parents can do is to relieve the stress, which means open, healthy communication is very important. If they start communicating with their children properly, sit with them, talk to them in a calm manner, it will relieve the stress and the anxiety, and the child can go to sleep restfully. Again, short duration of physical activity during any exam period is also actually helpful, because it improves the oxygenation in the lungs and in the brain, and this improves the mood, decreases anxiety, and leads to restful sleep in the night. As I said before, lack of sleep leads to anxiety. So a good physical activity, maybe for 10 minutes also, will work wonders.
In particular now, like for lowering the anxiety, you mentioned the sleep as one of the factors which increases anxiety. But what can parents do? How can parents lower the exam anxiety in children?
Well, this is a very important question, because it's not just the child's anxiety which has to be lowered, it is the parents' anxiety which also needs to be lowered, because somewhere they're transmitting their anxiety also to the children. Anxiety, as we all know, it leads to stress, and this affects performance. Why? Because stress causes mental fogging, and this compounds the anxiety more. So communication is a very important channel at this point of time. Okay? Speaking to your child in a very calm, controlled, and quiet manner. Not getting anxious, not getting hyper as a parent, not taking up their studies. You know, some parents get so anxious because they want to figure out how much their child has studied, that even for teenagers, they say, give me a book, let me take up your studies. So this creates a lot of anxiety. But if you speak to your child in calm, quiet, and in a controlled manner, and try to say that it's okay, you know, like it's okay to be tense just before an exam, but you could do some breathing exercises. So I will just demonstrate to you. So deep breathing exercises are very helpful because it increases the oxygenation into your lungs and to your brain. Okay, so when you're doing deep breathing, take a deep breath in, keep for a count of 5, and then exhale completely out. So let me just demonstrate to you.
Just breathe in, hold, and breathe out.
Doing this simple exercise for a count of 10 actually works wonders. Why? Because you realize that your own anxiety has also come down. Okay. Now, some amount of anxiety during exam period is fine because it leads to eustress, which means that that little bit of stress would actually lead to performance. But however, if there is a point when there is so much of stress and anxiety leading to loose motions, body ache, nausea, vomiting, headache, fever, that means it is leading to distress, and this should be avoided. So what parents can also do not talk about marks. Generally, what do we do? All of us do. Exam is equal to marks. Exam is equal to marks. So what you have studied, you forget because you are thinking on what marks you're going to get. But instead of thinking about your marks and your performance, just say, okay, I have prepared for this exam. I know I am well prepared. So just let me go and do my best. So here you are not thinking about your marks, and hence your output is going to improve. Also, few other points which parents must keep in mind. Dehydration. When the child is studying continuously or in an AC room, dehydration tends to set in, and this will also give rise to a feeling of anxiety. So ensure that your child has adequate fluids, be it in the form of water, nimbu pani, chas, coconut water, whatever, but ensure that it is there. Then divert their mind for short periods of time. Just studying throughout the whole day actually fogs their mind completely. So maybe taking a short nap, joking, chatting, doing a short physical activity, or even dancing for 10 to 15 minutes by listening to music will also help to relieve your anxiety. And last but not the least is during exam, as I said before, the brain uses maximum amount of glucose. So the blood glucose of a child also tends to fall. So here, giving a small snack or a fruit works wonders because the blood sugar gets leveled out, and many times a fall in the blood sugar can actually mimic anxiety. And once you give the snack or the fruit, the child just settles down and stabilizes out completely. So these are some of the few pointers which parents can do to lower the exam anxiety.
So Dr. Ma'am, you have given us good points what parents really need to do to lower the exam anxiety of their child, and even otherwise during and after, during the exam, before the exams, what they should be doing. With this, we come to the end of today's session. Ma'am, key messages for our viewers, please. Any key messages from you?
Yes, only one key message. Academic success is linked to healthy lifestyle, and you must follow a healthy lifestyle throughout the years. Healthy lifestyle starts from childhood and should be continued at all phases of life. This is my only message which I want to convey to the parents. Healthy lifestyle, and it decreases your anxiety and improves your academic success of your child. That's all.
So all viewers, please lead a healthy lifestyle, for an academic success of your children. It was a very interesting and informative session from you, ma'am. So with this, we end today's session, and we look forward to meeting you next Saturday again for another session on parental guidance on academic success for children. So thank you once again, ma'am.
Thank you so much, Dr. Mansi, and thank you so much to our viewers for being over there. And it was a wonderful session trying to communicate and tell you things. So do follow me on my Instagram and Facebook page. And if you have any questions, please feel free to put it across on my page and I will get back to you.
And I think, ma'am, we should continue sessions like this on a regular basis for which topics which are practical use to parents.
Of course. That would be very nice. Thank you so much. Thank you. Bye.
Okay. Thank you, ma'am. Thank you.